Local nurses and healthcare workers are reviewing their own preparedness in the event they encounter an Ebola patient now. 22 News reporter David McKay joins us live with how nursing schools and hospitals are preparing their people on the front lines.
The Massachusetts Nurses Association, which represents about 70% of the state's nurses, says not enough is being done to prepare nurses. It's a topic being discussed in hospital hallways and nursing schools. As the Centers for Disease Control looks into the protocols that were followed or not followed by two Texas nurses who contracted the Ebola virus from a patient, the Elms College School of Nursing has been analyzing what they teach their nursing students.
By looking at that critically and using that data for future, I think nurses can be protected from exposure.
Students I spoke with today said they're learning that it's the simple precautions that they can take that will make a big difference when they get into the working medical facilities.
Keep our standard precautions, wear gloves, always be cautious around bodily fluids, and just to, take every precaution we need to when we're in the workplace.
For nurses arriving for work at Holyoke Medical Center, the protocols have been modified with the knowledge of what has happened in Texas.
What can we learn from that to make sure that we can do the right thing for our providers? And I'm certain now that with the guidance we've gotten, that we've got a really good comprehensive plan that's being initiated right now at our hospital.
Holyoke Medical Center plans to repeatedly drill their nurses on isolation procedures and how to put on protective gear they'll need if they encounter an Ebola patient. Tomorrow morning, the Joint Committee on Public Health is holding a hearing on Ebola preparedness in Boston. Live in the studio, David McKay, 22 News.